Okay, now we shift the focus a little bit. The integration profiles that Don did present did focus on the workflows inside a single healthcare organization. With the IHE content profiles, that's the topic that I will cover now. We are talking about the interoperability between multiple healthcare organizations. So the headline just tells you we are talking about the intra-office data exchange. The path that IHE iCare used to achieve this is the path adapting the IHE7 version 3 CDA standards. Fortunately, with this standard, there is a lot of work done during the last 15 years to create what is called the clinical notes templates. It's based on the CCDA, the consolidated CDA. It's just a evolving stage of CDA that did harmonize multiple efforts through the past decade into a new standard platform that everything should evolve from here on. The CDA clinical notes are basically XML documents, but with a very heavy implementation guide that defines the rules how to use a huge schema. All these clinical note templates and the documents created from them are very useful in a general healthcare environment. So they can transport things like medication, allergy, problem list, and many more. But for people working in a specialty environment, they do have a big disadvantage as they focus on general healthcare aspects, things that the physicians in the specialty do want to know are not part of the content of those documents. So as an eye care professional, you will not find refractive measurements, you will not find IOPs, you will not find anything that really makes up the care that you want to give to a patient. So if there would be a way to incorporate eye care specific data into these documents, that would make those documents much more beneficial in the eye care. Okay, next slide. So the intention of the IHE iCare team was to close the gap by defining extensions to the CCDA clinical note templates, meaning it should be possible to add eye care specific data to the CCDA documents in a way that all systems that in the past could support general CCDAs could process and work with them as well after the extension, but give then the eye care specific systems access to those extended information. Besides this kind of machine processable content in the structured data, CCDA documents do contain a human-readable representation of the structured data, meaning it really doesn't matter if a system can display these extensions or process these extensions. A human, the physician, the healthcare professional will be able to get to this additional content by this human-readable representation without the need of the system to really understand the structured data that are contained in the document. There are two document templates that the IHE iCare team did enhance. That's the progress note that captures a patient visit. So we did define here a general eye evaluation, or G, as the extension, and another template, the CCD template, that normally gives you a summary of the patient. Sorry, my voice is fading. Just give me a moment. So for this template, we did define the eye care summary, or EC summary extension. To give you a better idea, if you ever have seen a CDA document, you know that the human readable representation normally starts with a header, and then you should have a table of content, and this table of content you normally find those things like problems, plan of care, etc. But with this screenshot, you see that there is a new top node that is called ocular physical exam, and that is the root node for all the entries that deal with the ophthalmic specific data. So to make it short, in the table of content, it's just a single root node that can be skipped in the structured data by systems reading the data. But then, if you go to the next slide, give you in the human readable representation, give you all kind of ophthalmic specific information. I just, as two samples, put the intraocular pressure and the visual acuity representation on the screen. For sure, these representations will differ as you're using a style sheet. That's a style sheet that is basically using the standard traditional tables. So it's up to vendors to define style sheets that maybe even fit more the standard representations that eye care professionals would expect. But as a starting point, that is pretty amazing that you just can read the data that you would expect in such a document if you are an eye care professional. Okay, next slide, please. Yeah, and the other sections would look like, people normally know them from the standard CDAs, for example, here, the problem list with the coded values and the observations when, etc. Next slide, please. So to summarize this a little bit, the extensions to the G, or the G extension to be precise, it contains routine eye exam information. It captures each patient encounter, meaning the visit, and it puts structured data using coded records that are based on SNOMED, LOINC, and other standards into the structured data, as well as it adding the human readable representation as I have shown on the slides before. Next one, please. We have the eye care summary, and this one is really for the purpose of transfer to referral or to give another care provider a complete understanding of the patient, including the eye care specific data. And again, it's just injecting the eye care specific data encoded using SNOMED and LOINC and adding this kind of tables. Next one, please. So these are all the entries or the topics that currently are supported by the G and the EC summary extension. That should be what you mostly want to communicate from a general eye care point of view. There might be later on more entries to be developed, but for now I think we have a pretty stable and beneficial state reached. It's last year it was the second trial implementation, so we're hoping to make some more progress this year to make it finally available to the users. And if we flip a little bit towards how it would be expressed in the documentation, you see the integration profile representation, that you have the actors, content creator and content consumer that do share the content. And there are a couple of options available, but basically it's someone putting this document together and someone reading this document. And if we are talking about consumer, we do not mean that a physician is looking and reading through the human readable sections. We do think about that the content consumer is really making use of the structured data and incorporate this information, if useful, into the patient file at the office receiving the documents. Okay, next slide, please. That's another look at the documentation, and if you know a little bit about CDA definitions, you will find a couple of key features like the cardinality at the beginning and then your template IDs that you need to identify the sections, the section codes, etc. So for those familiar with creating CDA documents, know what this means. Yeah, and that is the end of the integration profile presentation.